The programs will be invested in will be the environment, chronic diseases, addictions, protecting humans and wildlife, land, migration pathways, historical landmarks with accurate history, air and water filtration on industry, a universal pension plan, 7 Gens Global Lending Fund, and to strengthen democracy. There will also be investments into clean water initiatives. To assist with reconciliation, my corporation will be transferring 10% of the money to our First Nation division so that they can use those funds to invest in housing, clean water, and healthy, affordable, locally grown food. This is my gift to First Nation people, but also for them to know that they are woven throughout the system. So this money is just extra funds to help heal them from the generational trauma colonization has left on their people. The programs are different from Canada to developed and developing countries because of each country's need. 7 Gens programming in both GGDI and 7 Gens both have the same elements, such as Element 1, Earth Disposal Tax, E.D.T, which is green. Element 2 is the Instant Earth Investment Rebate, IEIR, which has 2 blues. Element 3, Tourist Footprint Tax, TFT, which is red. Element 4, Sales is brown. Element 5, Interest is purple. And Element 6, the funnel for the whole system into health and social programming, is pink. The goal of the system is the exact opposite of the current one that we are used to. Instead of all the money funneling up to the 1% so that they can hoard their money, the GGDI and 7 Gens will funnel money back into health and social programming to heal humanity through programming that causes great suffering and distress to the 99% of us. The programs and projects that I have picked for Canada were based on some of the needs I saw in the healthcare system and chronic diseases that my loved ones suffered from and are currently suffering from, and areas that are so underfunded in our system that people are dying from the trauma that the system failed to provide them. We will start with Element 1, 7 Gens programming, A, Canada Earth Disposal Tax, E.D.T, 7 Gens Program Number 1, the Karen McCarthy Lightspeed Generating Water Rail System, or CMLS GWRS. Investments in the largest green energy generating station that will carry and generate electricity and transport clean water across countries. We need to find a substitute for our coal and nuclear power plants, and this is one of the goals of the investment, to find the best and largest way to utilize our ability to collect green energy from solar, night, wind, hydroelectric, and collect energy from our rails. Our collective future of the world depends on us making the uncomfortable changes needed to ensure our world is sustainable, regardless of how long it takes and how much it costs. Our fossil fuel industry is not going to be happy about this, but we can't keep consuming our limited natural resources because our children and future generations depend on us. To make the changes needed for their sustainability, we will build and expand our ability to collect energy away from city centers so that we don't disturb their expansion. Once up and running with zero energy costs, extra energy generated will be sold back at a discount to the grid. Fresh water carried will be at a discounted price to make it affordable for fresh water. Ticket sales will pay for costs, and any extra money made will be reinvested back into the system. This element has several microsystems within it, or any extra money will be funneled to number 6, health and social programming. A, Canada Earth Disposal Tax, E.D.T, 7 Gens, Program Number 2, Tony Jocko's Diabetes and Chronic Disease Center of Excellence for First Nation people. In order to improve the health outcomes of First Nation people from diabetes and other chronic diseases, they need access to evidence-based practice and preventative medicines. This clinic is designed to house both First Nation traditional healing with Western medicines in a safe and ethical manner. Laboratory tests of kidneys, liver, and other tests to ensure that we are doing it safely. We will be able to offer First Nation traditional medicines, and when the disease changes, add in what is considered best practice from our medical care system. Tony Jocko was pivotal for us to have the right people at our meetings to equalize access to current best practices so that the outcomes would improve for First Nation people. It took almost 2 years to get rid of our healthcare discrimination that our First Nation people were suffering from. This neglect was and is still having devastating outcomes of early morbidity and mortality, as well as pain and suffering. Tony asked me to build him my dream diabetes center of excellence, so I wrote the proposal that weekend. I also added other chronic diseases that are being under or untreated in First Nation communities, and because of this, healthcare discrimination and is causing great suffering. These clinics will also incorporate interpreters and bring First Nation languages into our healthcare system. The clinic will start sharing data and improving outcomes, making traditional healing and medicines a part of our healthcare system. We will include support for treatment for early peripheral vascular disease to prevent amputations and treat ulcers early with the best research and practices. Other chronic diseases treated will be anemia as well as autoimmune diseases to start with. Canada Earth Disposal Tax E.D.T 7 Gens Program Number 3, Trauma and Addiction Centers for All People, that is First Nation traditional healing focused. These clinics will be designed to heal the generational trauma from colonization, residential schools, and the churches. This will bring traditional healing in First Nation languages into our healthcare system. By including and designing these clinics First Nation focused, it will enable First Nation people to heal themselves and introduce their beautiful spiritual teaching using their traditional healing and medicines from their ancestors. This will help from losing these precious traditional healing methods, but also sharing their traditional teaching with non-Indigenous people suffering from addictions that our healthcare system is failing. The programming will have a structure and will collaborate to have an all-inclusive way of healing from generational trauma. The goal is to ensure that all people have services and support to help them deal with the trauma that we have all experienced in our lives. Canada Earth Disposal Tax E.D.T 7 Gens Program Number 4, Chantel or Shawnee Ferguson, Sharon Shayfuse, Nicola Bartholomew Babalu Caveza Autoimmune Research and Treatment Center of Excellence. Each of these beautiful souls blessed this earth too short, and they left huge impacts on my heart and life, and I wanted to pay homage to them by naming them for my passion for early diagnosis and treatment of autoimmune diseases to limit their early morbidity and mortality on people suffering from them. Shawnee was one of my best friends growing up. Her and my parents were friends, and I don't ever remember her not being in my life. Shawnee was diagnosed with scleroderma at the age of 8 or 9, and that was rare. Shawnee was told that her life expectancy was 16 years of age, but she lived her life to the fullest and never missed out on anything, good or bad. Shawnee passed away at 29, and it was her love of life and spirit of never giving up that I want the world to know that she was one of the bravest people I knew growing up. Sharon, or Shay as we called her, was my husband's Pat's sister. They were 4 years apart, but we always said they were twins. She suffered from sarcoidosis that later attacked her neurological system, which ultimately took her quality of life and her life. Sharon asked me over and over to have someone look at her medical file to find an early diagnosis and treatment for sarcoidosis. The medical system failed her in many ways, and it is this reason that she wanted to find a treatment or cure for it. Nicola Bartholomew Caveza was our best friend and neighbor, who was also a manager in laundry at our regional hospital. Nick had an infectious laugh and had the biggest heart. Nick and Pat tinkered in his garage working on their trucks, puttering around, or having fun golfing. Nick died in 2020 and will be forever missed and loved by many. My husband Pat suffers from psoriatic arthritis, which is an autoimmune disease that is taking away his quality of life. I worked with pediatrics taking care of type 1 diabetes, which is also an autoimmune disease. Understanding how these diseases cause early morbidity and mortality in young and old people makes me want to find a way for early diagnosis and treatment with the goal of remission or cure. Currently, Big Pharma has these drugs priced out of reach of the average person, and only people with drug plans can afford treatment. This causes people to suffer early complications from treatable conditions. And it is because of this that we will be investing in providing good competitive research and development employment into these diseases with the goal of minimal cost to people to receive these life-saving medicines. This is the opposite of our current pharma system that runs on profits at all costs, even people.